That moment when you see a positive pregnancy test is quite possibly one of the most exciting moments women might experience. But after you see that, you may or may not know what to do next. Your first prenatal appointment should happen for sure by the 13th week of pregnancy, and you should plan on having at least 13 appointments over the course of the pregnancy. And prenatal care is so important because it helps to make sure that you and the baby are as healthy as possible. Your doctor might want to see you sooner than 13 weeks based on your history, like if you've had a complicated history with miscarriages or previous losses, or you have certain medical conditions, they might want to see you soon. But if not, your first appointment might happen sometime between 8 and 12 weeks. Pick and call an OB provider of your choice. They'll talk to you about your history and decide when you should have your first appointment. In addition to that, make sure that you're taking a prenatal vitamin each day, one that has at least 400 micrograms of folic acid in it. Drink at least 8 tall glasses of water a day, and eat a healthy diet. Now, for some women, this does get a little bit harder down the road as nausea starts to set in. And studies have shown that 90% of women are feeling nauseous, and they may or may not be vomiting, but this all happens by about 8 to 9 weeks. So once that starts to set in, you might find that certain things sound really yummy, and they may not be the things that are best for you, and you just can't stand the thought of other things. Try to eat as healthy as possible, and a lot of women think that they have to eat for 2 during pregnancy, but that's not true, especially in the first trimester. You actually don't need extra calories till you get into the second and third trimester, and even then you only need 200 to 300 extra calories a day. Fill your diet full of whole grains, lots of fruits and vegetables, low-fat dairy, lean meats, and healthy fats. If you've been exercising up to this point, continue doing what you've been doing. Chances are that it's going to be safe, and you should continue with it because exercise is great for pregnancy. It helps you to gain the right amount of weight and to stay as healthy as possible. If you've been participating in extreme exercises or other like athletic style training, talk with your physician first to make sure it's safe. And around 20 weeks of pregnancy, you shouldn't do anything that puts you flat on your back. So this might include like sit-ups and other activities like that. Think twice about all medications. Talk with your doctor before taking prescription, over-the-counter, or herbal medications. They'll decide what's okay for pregnancy and what's not. If you've been taking a prescription for something that's not safe during pregnancy, maybe they can find something to help that issue that is safe. Also stay away from all alcohol, all tobacco products, and illicit street drugs. There are no safe amounts of any of those things during pregnancy. Even secondhand smoke should be avoided when possible. I hope the best for you during your pregnancy, and if you have any other questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.